All right, happy Monday. Make sure we're all good here. Make sure sound is catching. It appears to be so. Mic check, mic check. Mic check, mic check, mic check. Mic check, mic check. So, looks much better. All right, guys, good evening, esteemed viewers, and welcome to a critical edition of Know Your Pharmacist Livestream. I'm Dr. Joaquin Acosta, your guide and companion on this journey of discovery and enlightenment in the ever-evolving world of healthcare. As the CEO of PharmTrue and a passionate advocate for progress in pharmacy tonight, I bring you a compelling blend of urgency and innovation. We start our show under a somber light, addressing a recent and unsettling incident, a shooting at Duran Central Pharmacy up in Albuquerque, New Mexico. This event is a stark reminder of the growing concerns surrounding safety in healthcare spaces, a topic that we delve into with both depth and sensitivity. Transitioning from this pressing issue, we will explore the frontier of medical technology with Nanowear's groundbreaking achievement. AI-enabled continuous blood pressure monitoring. This is pretty cool, and the wearable device is pretty awesome. We'll show you guys a little bit in a bit. This represents a monumental leap in our fight against hypertension, showcasing how artificial intelligence is reshaping patient care and diagnostics. In our Enlightenment Hour, we'll engage in a vital discussion on the impact of certain medications on cognitive health. Understanding these effects is crucial, not just for healthcare professionals, but for everyone who seeks to maintain their mental acuity as they navigate the complexities of modern treatments. Our Herbal Wellness Corner tonight takes a scientific turn, spotlighting a pioneering study by Johns Hopkins University. As they follow 10,000 medical cannabis patients, we'll uncover new insights into the efficacy and impacts of cannabis therapy, an area ripe with potential yet clouded by misconceptions. Additionally, in our community spotlight, we honor the We Warrior Project, a heartwarming initiative supporting families with babies in the NICU. This project embodies the spirit of community care and the profound impact of compassion in healthcare. And in our Men's Health Minute, we bring awareness to testicular cancer, emphasizing the importance of early detection and the power of self-care. As we navigate these diverse yet interconnected realms of healthcare, my goal remains steadfast: to empower, educate, and inspire you. Together, let's build a future where health and well-being are not just goals, but realities for all. Thank you for joining me on this enlightening journey. Let's begin. All right, guys, jumping in. I'm going to show you guys. So, Duran Central Pharmacy, for those of you guys who don't know where that is, it's a legendary pharmacy up in Albuquerque, New Mexico. It's been around for a really long time. An awesome restaurant just south of downtown Albuquerque, in that downtown area, guys. And there was a shooting there Sunday yesterday. Take a look at this.
Well, tonight, Albuquerque police are investigating what led to a shooting inside a popular restaurant near Old Town today. Police say one person was hit inside Duran Central Pharmacy earlier this evening. They went to the hospital, but officers don't believe their injuries are life-threatening. Still no word on any suspects or what led to that shooting.
It is back to work.
Exactly. Happens really fast. No idea what happened. There was a shooting up in Duran Central Pharmacy up in Albuquerque, New Mexico, and we don't get a lot of stories. Up in our retail pharmacies here in the state of New Mexico, that is a threat. That's not something that should be taken, lightly. Here, we've got our big box corporations and big box pharmacies that do not see these kinds of activities. This is a local pharmacy in the restaurant. Big shooting out there yesterday. One person shot in the Duran Central Pharmacy, historic restaurant, and that's totally not okay. And these are situations that definitely should not be taken lightly in the pharmacy world, in our local business, and any sort of issue there. State government, local government, county, whatever way you want to look at it, federal, it doesn't matter. It's just not okay, and we need to be able to address that. Again, if you're an employee in any of those situations, if it's a healthcare environment, of course you're supposed to, abide by whatever demands are supposed to happen. At the, fighting back is of your last priority list, right? You're not going to be that person that's going to be a security monitor at the same time as a healthcare provider. You're not expected to have, guns strapped around your waist and be able to defend yourself like that. in a working environment, in a healthcare situation in the state of New Mexico? Is this something, that should be really, really thought about? In every single situation, it absolutely should. And the, kind of vagueness of the Duran Central Pharmacy shooting is just even kind of more of a testament to that, for sure. So, if you guys have any comments about that, or if you've heard anything about the Duran's Central Pharmacy shooting that just happened recently yesterday up in Albuquerque, New Mexico, guys, drop that in the comments for what you know. Let's talk about that and make sure that, we know everybody is okay, and we get everybody back up to, a safe place and, a good point. Their Duran Central Pharmacy's Facebook, all they posted was they were going to be closed today. And so it was very, minimal in their comments there on their Facebook feed, which, I totally understand their privacy concerns there in that restaurant. And, anybody in a retail situation, anybody in a healthcare situation should not be afraid of, getting shot by any means, especially here in the state of New Mexico. I don't care if Albuquerque is crazy. Something that we want to make sure that we address and, have a reasonable conversation on going forward as well, wherever it is that you work, right? Anything like that. So let's look at our tech talk, guys. Interesting stuff. Nanowear's AI revolution. For anybody who hasn't heard of what Nanowear is, I'm going to show you guys a little bit of a preview of it right now. Boom, boom. So taking a look right here, boom. Nanowear, Simple Sense. It's a actual AI blood pressure, respiratory rate monitor that wraps around the body and is able to, have deep patient insights, and it's pretty cool stuff. So this just basically got FDA approval today. Simple Sense, an FDA cleared remote diagnostic platform. The non-invasive undergarment monitors multiple patient vitals such as heart rate, sounds, respiration rate, lung volume, and physical activity. Nanowear's patented cloth-based nanosensor technology captures over 120 plus million patient data points per day, right? So, just a simple, easy strap there. You don't have to be plugged into, all those machines that you think of in the hospital, right? That have that monitor that's right next to you. And again, this is probably more data points than all those wires in the hospital that you see, either if you're actually checked in or, just watching Grey's Anatomy a lot, right? This is a very, very simpler workaround if you can really see the efficacy that you can look at there. So, the cloth-based sensors and all that is some really cool stuff. And just looking at what came out of it today, Simple Sense is really, important technology to be able to highlight there. And so, talking today, FDA 510K clearance for AI-enabled continuous blood pressure monitoring and hypertension diagnostic management. It's a really good moment, for healthcare, the future of AI, where you start seeing the healthcare devices to be upgraded a little bit, right? Granted, our Apple Watch can do a lot, but not as much as like your Nanowear device. And you're going to see lots of different mixes of different kinds of technology that can definitely get applied and will get applied to our patient interactions and all of your patient metrics and your data points. But again, it's just going to be really cool to see where it all goes. And shout out to Nanowear for that little solution there. And, for you guys seeing that Simple Sense technology here, looking at it right there. That's your little example. All right, let's move on, guys. Enlightenment Hour. Let's keep this thing going. So some other interesting stuff. These guys up in Oregon, People's Pharmacy, they actually do a blog where they talk to their patients. And I thought this was pretty cool because it's like, right, like Ask Delilah or whatever. But, I think this is cool that pharmacists take their time to talk to patients and field questions. But this one was pretty cool. So dear People's Pharmacy, I was quite sharp until I got prescribed gabapentin and amitriptyline. Since then, my memory is garbage. I'm being tested for dementia. My neurologist said it couldn't be from the meds, but I am not sure I believe them. These meds are ruining my life. Do you have any advice? Well, we fear your neurologist has not been doing his homework. The Beers list of potentially inappropriate medication use in older adults indicates drugs that can cause problems for senior citizens. The old-fashioned antidepressant amitriptyline can lead to confusion and memory problems because it interferes with the activity of the brain chemical acetylcholine. This anticholinergic action is associated with brain fog and other cognitive difficulties. Gabapentin is a drug for epilepsy that is also prescribed for pain following a shingles attack. Many doctors prescribe it off-label for neuropathy or nerve pain. Research published in Frontiers in Pharmacology last year, November 5th, 2022, or year before last now, I guess, found a link between this medicine and cognitive decline. In conclusion, this study showed that among older adults with normal cognition, initiating gabapentin was significantly associated with clinically meaningful decline in cognitive and functional status and increased falls. Further studies are needed to examine the risk and benefit of prescribing gabapentin in older adults, something that's commonly thrown out there, right? On many people's regimens. Gabapentin is something that's there. For you guys who are listening that take medications or know people that manage people who are on medications, especially in that senior class, gabapentin is going to be one of those very, very common ones. So again, as People's Pharmacy advised here, very good advice. Ask your neurologist to reevaluate these prescriptions with an eye to gradual discontinuation. To help with the process, you may wish to review their Guide to Drugs in Older People, which discusses Beers criteria list in greater detail, right? So, showing that here, healthy guides, cool stuff from the People's Pharmacy. Battle and baldness, drug and food, drugs in older people. So here's one of them. It's free for people now. Either way, I think this is really cool stuff. Resources that are out there available, for the community, for everybody, and this is really cool stuff. So basically, guys, gabapentin, Beers criteria for any of you guys who have what those medications are that increase fall risk and cognitive decline. I'm just going to go over a quick reminder of all of that because I always think it's something very important to continuously hit. Again, for whether you're pharmacy students, pharmacists, nurses, anybody in facilities, the Beers criteria. Again, American Geriatric Society Beers criteria for potentially inappropriate medication use in older adults is a list of medication guidelines that help healthcare providers safely prescribe medications for older adults over the age of 65. Studies show that over 90% of adults over age 65 take at least one prescription medication, while more than 66% of the same group take more than 3 prescriptions a month. The Beers criteria list of potentially harmful medications or medications with side effects that outweigh the benefit of taking medication. Beers criteria is also known as the Beers list. So what are the Beers criteria? The American Geriatric Society uses specific criteria to list potentially inappropriate medications for adults over 65. The 5 sections of the Beers criteria are medications to avoid if you're over 65 years old and not in a hospice or palliative care setting. Medications to avoid among people with certain health conditions. Medications to avoid that cause drug interactions when combined with other medications. 4, medications to avoid due to harmful side effects that outweigh the benefits. 5, medications used at limited doses or avoided due to their effects on kidney function or renal impairment, right? So, examples of medications on the Beers criteria list right here, close to 100 medications, analgesics, meperidine, antibiotics, even ciprofloxacin with warfarin can increase bleeding, carbamazepine, brompheniramine, alpha blockers, right? Antipsychotics, anxiolytics, benzodiazepines, right? Your common ones, grandma and Xanax might have been something that was a more common association back in the day, but really, it was causing grandma to fall, right? Grandma shouldn't be on muscle relaxers, significant ones, right? Barbiturates, anything like that. No way. You're not, trying to induce any sort of confusion. And imagine the amounts of medications that are older adults end up on that actually have the overlapping effects. It's insane. Of course, it's the job of the pharmacist to be able to review that, to check that, to make that a safer option for people. But you'd be surprised that people do not always have that access to care. Pharmacists, in one pharmacy may only have such a small window of a lens to what medication might be available to a person even at any given time. So, Beers criteria, a very, very important thing to understand that really can affect cognition and decline in our older adults, right? Cannabis is not on the Beers criteria list. That is one big one that is definitely not, and something important to point out, especially in, you know, in my opinion there. And leading up to our next segment, Herbal Wellness Corner, brought to you by High Horse Cannabis Company. Shop, High Horse Cannabis Company right here for all the best deals in cannabis. Las Cruces, New Mexico, Hobbs, New Mexico, Chaparral, New Mexico. Got you covered, guys. Looking over Johns Hopkins researchers to follow nationally representative cohort of 10,000 cannabis patients in federal. So some really cool news. So what is it? A new study by researchers at Johns Hopkins University will track 10,000 medical cannabis patients over or more in an effort to better understand the efficacy and impacts of cannabis therapy. Funded with a 5-year, $10 million grant from the National Institute on Drug Abuse, NIDA, the research team will work with federal researchers in the nonprofit realm of caring, among others, to collect data around dosing, delivery methods, the chemical composition of products, possible medication interactions, and other treatment details. All cool stuff, right? Our mission with this research is to understand the health impacts of therapeutic cannabis use. One of the study's co-creators, Ryan Vandry, a professor of psychiatry and behavioral sciences at the Johns Hopkins University School of Medicine, said in a statement. We hope to provide some starting points for understanding what types of products may or may not be helpful and what types of products may be more risky for use in certain populations or for certain therapeutic processes. Under the umbrella term of cannabis exists hundreds of products that are all different in very important and significant ways. We're trying to narrow the scope of a little bit, find areas of real promise, and focus on the science of those. Despite a notable increase in published research around cannabis in recent years, obstacles to science caused by federal cannabis laws mean clinicians are still playing catch up in a country where more than 3/4 of states have legalized the drug for medical use. We have availability of cannabis as a therapeutic, Vandry said, but we're lacking the quality of data that we have with other medicines. That's the nail on the head. The press release says the National Cannabis Study, which is a part of a larger cannabis and health research initiative, will follow the nationally representative cohort consisting of an estimated 10,000 patients as they progress from cannabis naivety through a year or more of cannabis use. We're tracking them with multiple assessments over the course of their first year, with more tightly spaced assessments towards the beginning, because our assumption is that people are starting their medical cannabis journey. They're going to try different products until they find the best products that help them with their symptoms, said Johannes Thruel, a project collaborator and mental health professor at the Johns Hopkins Bloomberg School of Public Health. As the university pursues its own research initiative, the National Institutes of Health, NIH, recently posted a notice of funding opportunity announcing that it is looking for an entity to operate a new resource center for cannabis and cannabinoid research, a cooperative agreement to address challenges and barriers to conducting research on cannabis and its constituents. Addressing cannabis research barriers has been a key priority for multiple federal health agencies as scientists continue to face an onerous and costly registration process in order to access cannabis use due to its current status as a Schedule I drug under the Controlled Substances Act. So, that policy is actively under review by the DEA following a U.S. Health Department and Services recommendation to move it to Schedule III. Very, very exciting for the world of cannabis and healthcare. I think it's an awesome study, to know that, we've got millions of federal dollars actually backing a 10,000 person study over 5 years. Cool stuff to see, and hope to see plenty more of it, right? For sure. And that's some stuff we absolutely love to report here at the Herbal Wellness Corner. So, take a look at this, guys. The We Warrior Project, our community spotlight, brought to you by the Big Chicken Farm. Let me just pull this up real quick. So this is pretty cool. A new project locally from a nonprofit here in Las Cruces called We Warriors. We're launching a new project, NICU support boxes, free to all New Mexico residents with babies born medically fragile that meet the criteria for support. These boxes will contain items to support mom and baby while they navigate the new and coming home experience. Items in boxes will include, but are not limited to, breast pads, feminine pads, digital thermometers, breast hot cold packs, shelf-stable healthy snacks, hand sanitizer, and produced self-care items, baby probiotics, chapstick and hand cream, journal and pen, gel saline, breast milk bags, literature from state-funded programs, available for mom and baby, WIC, ECECD, breastfeeding task force, baby blanket, beverage vessel, and more. How can you help? Needing funds for the project, right? You can donate monetary funds towards the project so we can procure what is needed for each box. Donate items. If you have a retail store that sells items needed, we'd love to help with the items. If you have a business you would like to promote in your county, donate items needed with your logo. What will I get out of this by donating? Marketing risk recognition. We will have a list of our donors and ambassadors listed with their specific information for business, family, or in honor of in each box on social media and on our upcoming website. Companies who donate monetarily will be able to put in information and swag to represent their local services in a box. Ready to get involved? Email us at wewarriorsprojectnm.com. Reach out to them on Facebook or Instagram. It's a great opportunity to show our New Mexico families with children or that we carry these boxes will provide needed items that people don't give, and even more information on resources available to them, usually for free, that they may not know about. Very, very good stuff, guys. Absolutely. Thank you to the We Warriors Project. All right, man. Little Monday reminder here. Testicular cancer, guys. Now, we're not going through any demos today, but we're going to be talking testicular cancer checks. I should be doing, considerably once a month. According to the American Cancer Society, 1 in 207 men will get testicular cancer. Even though it's one of the most curable forms of cancer, the earlier you find it, the better your prognosis will be. The best time to do the self-exam is in your morning shower when the skin of your scrotum is relaxed. Do a testicular self-exam. Hold your penis out of the way and check one testicle at a time, assuming you have two. Hold the testicle between your thumbs and fingers of both hands and roll it gently between your fingers. Look and feel for any hard lumps or smooth rounded bumps or any change in the size, shape, or consistency of the testicles. And if you find something unusual or something you're not sure about, see your doctor right away. Guys, I know, some guys may call that an uncomfortable conversation, but again, you can already get the head start before you go into the doctor's office by already knowing that about yourself. There you go. That's our Men's Health Minute for today. Hope everybody has a great Monday. Happy Monday, kicking this bad boy week off the holiday, January